Hello, everybody. This is Dr. Bob DiMaria with another episode of Ask Dr. Bob. What do you recommend for cold-like body aches and pains to boost your system? Well, probably you have a low thyroid or subpar thyroid function. Common body signals: cold hands, cold feet, coarse hair, constipation, and fatigue. Now, what I would suggest that you do is have a thyroid blood test done. You want a TSH, a T3, and a T4. And you can actually go to our website and you can order that. What else I would suggest, because you talked about your immune system, is a blood test that we use called the CBC with a differential. Now, this is included in our OptiChem blood tests. I'll be looking for different markers, including your white blood count, your neutrophils, and your lymphocytes. So we make our decisions and recommendations based on objective findings. CBC, thyroid panel. Dr. Bob, what is good for a chronic bladder infection for a woman with type 2 diabetes who gets infection each time she eats sugar? And maybe it happens every 3 months. So I guess, do you eat sugar every 3 months? Question mark. Okay, so what do? Well, obviously you're going to want to minimize and eliminate sugar, because what I've learned since 1978 when I first started in practice, bacteria, unfriendly organisms, they do like sugar. You may consider a CBC with a differential. It's a blood test. It's a part of our OptiChem profile to see if you do have an elevated white blood count or maybe your immune system is really weak. We treat that accordingly. Oftentimes for a chronic bladder infection, we might use a product in our practice called ADP, which is emulsified oregano. But there's a variety of products that we use based on your findings. Drink water, avoid sugar. That's a very good question, by the way. I've been diagnosed, this is an interesting word for you I'll say it slowly, fistula recto-vaginal. What does that mean? Well, this individual is having some challenges between her rectum and the entrance to her vagina. Quite common, especially if there might have been a traumatic childbirth. Maybe there was some tissue that never healed properly. It could be a hygiene issue. I would encourage going once again to a CBC with a differential to see if you have some type of an infection that's long-term, really deeply seated in your body, maybe a chronic urinary issue. Do you have parasites? Parasites are quite common anytime we see a fistula. And we look at your CBC with the differential, we'll look to see your basophils. I know it's a lot of scientific terms and words, but this is a very serious issue, and it's quite common, these vaginal bladder issues, especially in older women today. Dr. Bob, what do you recommend for someone who occasionally passes kidney stones with pain? You want to know prevention and how to quickly go about doing it. Well, what I would want to know is your calcium phosphorus ratio on your serum blood test. It should be 10 parts calcium, 4 parts phosphorus. But I don't know what kind of balance is going on there. Also, I'd like to look at your urine test. What kind of crystals do you have? What's the pH of your urine? Is it a cloudy urine? So there is so much for us to discuss before we can make any kind of protocol or decision. You may consider a urine analysis, a CBC with a differential. I'm Dr. Bob DiMaria.